brought to you by the Dao Health.
This is Delve, a podcast that endeavours to enlighten and support you in understanding and transforming your own health.
Hello, my name is Elizabeth Cullen and my co-hosts are Clarice Berry and Molly Burton. And together we will be drawing on the Dao Health's signature and unique integrative approach to traditional Chinese medicine.
So take a seat at our table, grab a tea, and let's dive deep into the enduring legacy and evolution of medical practices over time.
This episode is proudly brought to you by Vitally, our trusted platform for connecting patients with practitioner-recommended supplements and lifestyle products. As a practitioner, Vitaly's platform is seamless to recommend everything from high-quality, practitioner-only supplements to non-toxic skincare, eco-friendly cleaning products and wholesome healthy snacks, all in the one place. For patients, Vitally supports your health journey in the most convenient way possible by bringing high-quality options right to your doorstep, curated by your practitioner, just for you. Thank you so much to Vitally for making this episode of Delve possible.
Hi guys, welcome back to another episode of Delve by the Dao Health. My name's Clarice and I'm joined by the lovely Molly and Liz.
Hello.
Hi.
Hello.
So I thought we could start off by telling our listeners a new beauty or health recommendation that you guys have.
I'll start. So I'm loving the Sandor Gua Sha comb at the moment. It's made out of Bjornstone, so it's this really beautiful weight and it feels really nice and cooling on the scalp.
Lovely.
Not only is it supporting blood flow and circulation to my scalp for my hair, but I also find it really calming. So I'm using it to apply pressure to do my 24 and then do 20 and it just is so relaxing and it's a lovely way to finish the day.
Sounds amazing. I, for one, just been using the new COSAS foundation. What's it called? The Revealer Skin Improving Foundation, which has got a little bit of SPF in it too.
Ooh, nice.
But I find it really works well with your skin texture. So definitely a good rec for our listeners to get into as well.
Yeah, love that.
Okay, so in today's episode, we're going to be unpacking how Chinese medicine and acupuncture can improve IVF outcomes. So a few weeks ago, we actually polled our Instagram and listeners on whether they knew somebody personally that had gone through IVF or themselves have gone through IVF, and 94% of our listeners said yes. It's a huge number, and when I actually had a little look at the NZAD annual report, which their most recent one was only done in 2022, which compiles all the data from 95 IVF clinics across Australia. And in 2022, there were 20,058 babies born following ART treatments in Australia and New Zealand. So that actually, it's a massive number, isn't it? And that actually means 1 in every 18 babies in Australia were born through IVF.
Wow.
Massive number. And according to that report, 1 in 3 of the IVF cycles were undertaken by single women or by 2 female parents.
Oh, really?
Yeah.
Okay, that's amazing.
Okay, so we're going to jump straight into our dynasty segment, which we're going to delve into the history that is IVF or in vitro fertilization. So the development of IVF is truly marked as one of the most groundbreaking medical procedures of the 20th century, which finally allowed couples struggling with infertility or same-sex couples to have biological children, or even single women as well and single men to have children themselves. A fun fact, the term in vitro is derived from the Latin word vitrum, which means glass. So in vitro literally translates to in glass. Now, isn't that fun?
I didn't know that. That's really cool.
Isn't that fun?
Yeah, very fun.
So some of the earliest ideas surrounding infertility and assisted conception can be traced all the way back to ancient Greek, Hindu, Roman, and Egyptian cultures. However, most of these practices are really based in ritualistic or spiritual practices. So for example, in Egypt, fertility was considered to be a gift from the gods. So women would actually wear amulets as protection against infertility or might offer incense, food, flowers, or precious stones to the goddess Hathor, who was the goddess of love, women, and fertility. And interestingly, as Hathor was seen as the goddess of beauty as well, it was common for women to leave mirrors or their cosmetic palettes as offerings.
Interesting.
Would
There
you
we
ever love a
go.
Sephora and Mecca palette? I don't know.
Well, I'm not much of a makeup girl, so I like anything for fertility, but 100%, I would imagine.
100%.
Yeah.
If you're interested in a photo of seeing who Hathor is, we're going to link all this in our show notes too. But in Judaist texts, there's a text called the Babylonian Talmud, which actually has some of the earliest references to the concept of surrogacy for the treatment of infertility, which is where a woman who was unable to conceive may actually borrow the womb of another woman to carry her child.
Oh, okay.
So interesting. And then even interestingly, there's a fantastic cornerstone Sanskrit text called the Mahabharata, written in the 3rd century BCE, which in some ways predicts the process of IVF. So in this story, a woman called Gahandri delivered what is described as a mass of flesh after 2 years of a pregnancy that contained 101 cells. A sage then instructed her to put that into 100 pots of ghee, which after 1 year, the cells transformed into 100 male children and 1 female child. Just so interesting.
Wow.
Okay. But then, really, it wasn't until the 18th century when the first experiments on fertilization was documented, and an Italian biologist called Lazzo Spallanzani, this is where I'm going to trip over my words, guys. He actually began experimenting with animals like frogs and fish by collecting their eggs and introducing sperm to them to understand the process of fertilization. So he's actually credited to be one of the pioneers of artificial insemination, where previously it was thought that life could emerge from spontaneous generation. So interesting. Then by the 20th century, the Charles Darwin theory of evolution spiked interest in understanding the role of sperm and ova, or ovarian eggs. And by the 1950s, scientists like Gregory Pincus, who helped develop the birth control pill, and Rita Levi Montalcini.
Well done.
Thank you, guys. And John Rock, a US gynecologist, made huge discoveries on how hormones influenced ovulation and fertilization. They also developed the first culture medium to keep human eggs alive outside of the body.
Interesting.
Then, by 1960s, a researcher called Albert Tatum and others developed the first commercial HCG products. They actually did this by extracting HCG from the urine of pregnant women to help treat infertility by inducing ovulation.
Wow.
Isn't that amazing?
That is so clever and so creative.
So creative.
Like, how do you actually think of doing that?
I know, right? Then, by 1969, a physiologist called Robert Edwards, a gynecologist, Patrick Steptoe, and an embryologist called Jean Purdy began developing IVF technologies for humans and successfully achieved the first egg retrieval from a human ovary. Then, by 1976, a couple known as Leslie and John Brown, who had been trying to fall pregnant for over 9 years due to having blocked fallopian tubes, actually met Edwards, Steptoe, and Purdy. And 9 months later, the first test tube baby, Louise Brown, was delivered by caesarean section at the Oldham General Hospital in England. Then, after that miraculous first IVF baby, her sister Natalie was also conceived by IVF 4 years later.
That's an absolute miracle.
Isn't that a miracle?
Such an amazing discovery.
Huge.
To be able to create human life is unbelievable, and to be able to provide families, children.
Isn't it just fantastic?
Before that it wasn't even possible is like mind-blowing.
And recently Netflix just launched the movie Joy, which shows the story of Leslie and John Brown and when Louise was brought into the world, which is absolutely incredible. And to actually see the the highs and lows of that discovery in terms of IVF and where they got to in order to have baby Louise is really incredible. And it's such a great movie. So if you haven't seen that one, I definitely recommend. It shows the ins and outs, especially if you're not familiar with IVF or what that involves.
Yeah. Okay, girls. I think we need to tell the listeners about how acupuncture supports natural cycles and conception before we really jump into how it fits into the IVF circle.
Yeah, definitely. So in terms of acupuncture for natural cycles and conception, we utilize different points on the body that have specific actions. So when a woman comes into the clinic at the Dao, we firstly go extensively through her menstrual history and all her reproductive history to really unpack anything that could be in the form of diagnosis for us. Then we utilize Chinese dietary therapy, acupuncture, Chinese herb supplementation to support her overall well-being. But what the acupuncture is actually doing to support the natural cycles. So, for example, we're going to ask the woman whereabouts she is in her cycles. That's why we recommend to track your cycles. And we're going to be popping acupuncture points into certain positions on the body. So, for example, coming into the follicular phase, the key point here is to encourage blood flow through to the ovaries to support ovulation. So we utilize points like spleen 6, which we mentioned in previous episodes, to encourage blood flow all the way through to the reproductive organs and to help follicular growth. Now, this is supporting estrogen levels. So in Chinese medicine, we look at estrogen from the perspective of kidney yin. So kidneys in Chinese medicine is a massive part of reproductive health. It's important to govern our HPO axis. So we talked about that in our first episode on endometriosis, about the connection with the hypothalamic hypothalamic, so a bit of a tongue twister as a
hypothalamic pituitary ovarian axis. HPO axis.
There we go. There we go. So supporting that connection with the hypothalamus in the brain and the ovaries in the abdomen to ensure that they're communicating effectively. So we're utilizing local points on the abdomen to encourage that communication pathway to occur. Then, for example, if a woman is open to conceiving, ovulation has occurred, and we may see the woman in her luteal phase, whether that's a week later or fortnightly when we're working with a natural cycle. Now, in this phase of the cycle, it's really important to work with the progesterone levels. So once we ovulate, we produce progesterone. So progesterone's our nice calming hormone. It supports a potential pregnancy, and then it will continue to rise if the pregnancy is successful. So when we think about it from an acupuncture lens, we don't want to move like we were doing in our follicular phase. We really want to hold and support the body. So we utilize lots of kidney points, our lovely kidney points around the ankles, which I know our listeners may not love, but
and lots of heart calming
lots
points.
of heart points. So we actually don't needle anywhere locally on the abdomen during this phase because we don't want to move. We want to hold and support the kidney yang in Chinese medicine.
And an embryo likes a hypoxic environment. So you would think, oh, let's get that blood flow through to the pelvis through this time. But actually, the embryo knows what it's doing. Just leave the potential embryo alone to support implantation.
Yeah, you think about it like a big raging rapids. If a little embryo is trying to hold on to something, the more blood flow there, it's going to be really hard for it to attach. Whereas if nice and still, like a dam or a river, it can just float on, hold on to something and attach.
Absolutely. And you've already nourished the soil.
And you've already nourished the
follicular
soil.
phase.
And so it's really important that we support the woman in terms of her central nervous system.
Absolutely.
So whether you're undergoing IVF and you're in that 2-week wait, which we'll get into, or you are in your luteal phase and you've been open to conceiving for many months, we understand how what's a good word? How taxing being in your luteal phase can be. So, we utilize this time. It's so lovely to come in for an acupuncture treatment.
Absolutely.
We support the kidneys. We ground the shen, as we talk about in Chinese medicine. So supporting the heart and allowing the mind to hopefully rest whilst on the bed.
Yeah. And also, when you think about it in an IVF cycle, in that 2-week wait, you've seen your specialist all the way through to that time, and now we wait. And then there's no care throughout that period of time.
Yeah,
and that's why it's so important to be held through the most difficult time of the full cycle, in my opinion.
Incredibly. And just on that note too, with preparing women in their natural cycles too, then moving into IVF, also men, come on in. If you have, if there's male factor fertility involved there, or you just want to optimize sperm health, come on in for your treatments too. And that also means starting all the supplements 3 months prior before going into an IVF cycle.
Yes, 72 to 90 days for spermatogenesis. Come in, men, at that time, the same time that your partners are starting to work on themselves, ideally a year before.
Definitely.
Is the time when males also need to be cleaning up their act.
Exactly.
As we love to say, nourish the soil before planting the seed.
Exactly.
Absolutely.
Now, when we actually polled our listeners, 29% of our community did not use acupuncture alongside their IVF cycle. And that's a statistic that we need to improve, ladies. And I think that just does come down to the awareness of it, but also understanding the research behind it. So I'm just going to delve into a little bit now. What we do know is that acupuncture is evidence-based, but it's also a safe intervention to use happily alongside an IVF cycle. There's no interaction with receiving acupuncture when you're doing IVF protocols or stimulation medication, and they can be used alongside each other fantastically. So An RCT study was done by Ju Hwan Kim, which actually showed that acupuncture increased the number of retrieved mature eggs and the fertilization rate in patients with poor ovarian response or those who were aged 37 years or older. And this is really interesting and good to know because according to the latest NZAD report I recently mentioned, the average age of female patients undergoing IVF was 36 years, and about 25% of those women were actually aged 40 or older. So we can take away that acupuncture will help improve those outcomes of those eggs matured and also the fertilization rate too. Then there was also another wonderful article written by Carolyn Smith and Mike Armour, which indicated a 32% increase in ongoing pregnancies and live births and reduced miscarriages when acupuncture was used compared with the control. They also discovered that a greater number of acupuncture treatments actually increased the clinical pregnancy rates, and a total of 12 sessions of acupuncture had improved outcomes for live birth rates over IVF transfer alone. So what we do know is that acupuncture has a dose. So, girls, how would our patients practically schedule their acupuncture treatments alongside their IVF cycle?
Great question. So I think it's commonly known to have a treatment pre and post transfer, but the research shows, as you've just said there, Clarice, is that it's a minimum of 12 sessions. So ideally we've been seeing and supporting this patient, and if they're in a heterosexual relationship for a preconception period, but if we're talking about that 12-week block, then ideally we will see them 4 to 8 weeks weekly leading up to the cycle. And then throughout the IVF cycle, we're seeing them weekly to begin with. So we're supporting stimulation to support an optimal outcome from that egg retrieval or egg pickup. From there, 24 to 48 hours post egg pickup, we like to see our patients to help reduce any bloating and pain. This is really important, especially if they're going through with a fresh embryo transfer, because they're really thinking about that transfer on the back of that egg retrieval, which can be quite invasive, and each patient responds differently. Then from there, depending on how they're tracking and how their body is responding to the medication protocol, we will then see them within 24 hours, making this very clear, within 24 hours before embryo transfer, and then in the 24 hours post embryo transfer. The research from Carolyn Smith and Mike Armour show that that's really key for optimal outcomes of live pregnancy birth rates.
Yeah, which is really important distinguisher to make when you're looking at research for IVF, because a lot of IVF clinics would go off just conception rates or potentially like a dating scan rate. But we want to look at the research based on live birth rates and full-term pregnancies, because that's where the data really, really shines.
And also we want our patients taking home a healthy baby.
Yeah, definitely. Ultimate goal.
Ultimate goal.
We do.
From their post-transfer, we like to see our patients weekly within the 2-week wait.
Yeah.
And then we're also recommending our patients to book in their appointments weekly, assuming they're pregnant too.
Yeah,
and I think from that perspective side of things is let's book that in, because that's the plan.
That's the plan. And I think, you know, it is a huge mental game when you're in that 2-week wait. And obviously the main outcome that we're looking for is a positive pregnancy test and that pregnancy continuing. But if, you know, bleed arrives and there's no positive HCG, we're still going to be using weekly treatments anyway to prepare you for whether that is taking a break in between, which is really important to make a note of, that we take breaks in between our IVF cycles.
Mindful IVF.
Mindful IVF. But if personal choice means you're going forward with another transfer because you've got a cohort of embryos frozen there, or you're going back to back with another stim cycle, then we're ready to go. We've already got that booked in.
I think it's also important in terms of when you come in for your acupuncture weekly, you can have an open discussion with a practitioner. IVF in itself is very overwhelming, especially if it's your first stimulatory cycle. Understanding the ins and outs of why you might be feeling like that. There's lots of drugs going on, you know, then getting to the retrieval and straight into the transfer. You know, we have those open discussions. We hold space in the room for patients, so they can also have that time to check out on the bed. You know, acupuncture is an amazing tool for all the things that we've just mentioned in terms of supporting the IVF cycle, but it's also an invaluable tool to support your central nervous system.
Yeah, definitely.
And holding space in that time when it can be really confusing.
Yeah,
absolutely. Absolutely. And also we can't take away from the consultations that we have with our patients too, of unpacking any questions that they've got from their fertility specialist, their outcome with egg pickups. That's something that we always celebrate with our patients, when whether it be one embryo or two embryos that have made it, that's still an amazing outcome. And I think when you're really stuck in IVF and you're really going through the motions, it's important to have that space to unpack that with us as well as their fertility specialist.
Definitely. And I think when you're sitting on that IVF or fertility train, it's important that you're heading in the direction of a baby is what we're hoping for, but you take time to look outside those train windows and enjoy the beauty that life already is, and make sure you're not getting all consumed, because it does get all consuming.
Absolutely. And you are a person. You're not just your eggs.
Not just a number.
And not just a number, which I think is so important. And when you go round after round, sometimes when you're on that fertility train, you're not looking out the windows, and it's important that you're reminded that you are a being and a person, and you have other important values around you and things that you enjoy. And it's okay to pause your fertility journey as well, to enjoy those things.
Incredibly. And I think also, just on the note of like reflecting on how your previous cycles have gone, that's where our consultations, I think, really shed light on, like, okay, before we just jump into another cycle, what have we achieved? How many eggs are growing? What are the quality of those eggs? How many of those eggs made it to day 3? How many made it to day 5? Were we having successful implantation but then early pregnancy lost? What's happening with your partner's sperm quality? Have all the parameters, including DNA fragmentation, been tested? We need to really unpack all of those different elements and actually look at how we can pivot on that IVF journey to make sure that we're getting that successful pregnancy and we're not just going back to back to back to back of rounds of IVF.
Absolutely. And on that, Clarice, you make such a good point, because it's like, if we can have the space to think about, is there something that we can pivot with or further investigate? If there's frozen embryos there, let's leave them in the freezer and let's talk about the home, so the uterus. Let's talk about the body. Let's see what we can do to get you into that optimal state. And what that may mean is taking a break. Which is really hard to hear sometimes with patients. But at the same time, if those embryos are ready to go, they're so precious. Let's just keep them there and really get you into the best state possible, so we've got this nourishing, nurturing home ready for that embryo in the future.
Definitely. And I think as well, trust your gut. If you're not feeling confident with the opinions or the advice you're getting, it's okay to get a second opinion. It's really important during all reproductive health, but especially IVF, that you have a strong shared care team that you can trust. And if something's back to back and there's no change and we're not moving with the outcomes and the information that we're receiving from each cycle, potentially it's worth looking in other ways and opening up.
And advocate for yourself. You can ask your specialist questions. I always say with my patients, go there
Write them down.
With all the questions that you want answered, because they're busy. I mean, specialists are really busy. They're seeing lots of patients and they want the best for you. But because they are busy, sometimes they skim over things that they think you assume you already know. But ask them. Make sure you're getting all the answers before proceeding.
In writing.
In writing.
Yes,
everything
definitely.
in writing.
Email.
Yeah, email, yes.
Okay, let's move on to our Dear Dao segment, girls. So this is where our listeners can anonymously ask all of their questions or concerns they may have for us to unpack as TCM practitioners. Question 1. I have been told that we need to use ICSI procedure in our next IVF cycle. Why is that?
Ooh, good question.
Who wants to take it away?
I'll start. So possibly there is a sperm quality factor here, depending on when the sperm analysis was taken, what was tested. I would hope that the fertility specialist has had that open discussion with the woman and her partner, so that they're really across why they're using ICSI. We also know that there's other options that may be better now as well. There is Pixie and ZMOT.
And IMSI.
Oh, so is it Z? Not what's the
That's a new technology.
That's a new technology, which I think is part of the Pixie.
Oh, Pixie. Okay. Yeah. Okay.
So I was going to say, first and foremost, ICSI stands for intracytoplasmic sperm injection, which is basically where your partner will give a sperm sample. And if your partner doesn't have the best swimmers, they will look through those sperm and select the best possible swimmers. And they will, instead of doing plain IVF, where they will mix sperm and eggs in a petri dish together and see what fertilizes, they will directly inject that sperm into the egg to achieve fertilization, just to make it a little bit easier for your partner swimmers to do that job.
Give the sperm a head start.
Yeah, exactly. And then as Liz was mentioning, PICSI stands for physiological intracytoplasmic sperm injection. That's actually where sperm are selected based on their ability to bind to a hyaluronic acid, which is a substance naturally found in the egg's outer layer. And typically these sperm have better genetic integrity and a higher likelihood of fertilizing the egg.
So that would be a question that you ask your fertility specialist as well. Is there the option to use PICSI over ICSI?
Yeah. Exactly.
Definitely.
And then on top of that, yes, it's new technology, but if you could then ask for ZMOT or ZMOT, I don't know how to pronounce it, sorry. But with that one, that would even be asking those options.
Yeah.
So that you're feeling really across why you're using ICSI. And again, if that hasn't been covered, let's pull it all the way back and let's talk about the sperm quality side of things. And is anything being done at this stage for your partner's sperm quality? If not, if the partner wasn't even taking a paternal prenatal at this stage, let's get into that first for 72 to 90 days of looking after the male partner before even thinking about going down ICSI.
Definitely. And I think also sometimes fertility specialists choose ICSI when you might have had multiple egg collection cycles, but you're not getting any fertilized embryos. And the thing, unfortunately, that I do find is specialists will test your partner's sperm and say, yeah, but all looks all right, but doesn't matter. We're going to do ICSI because we're going to select those sperm. But if your partner's sperm quality, their motility, their morphology, which is just the shape of their head and their body, and also their DNA integrity, which is measured by DNA fragmentation, if any of those parameters are out of alignment, it's likely implicating their ability to, one, fertilize the egg, but also do all of that cellular division and activity that happens in the first early stages of that embryo becoming a blastocyst as well. So we need to really question our specialists on why we're doing that. Yeah.
In writing.
In writing. So in that same NZARD report that I talked about before, the report found that male fertility was reported in approximately 1 in 3 IVF cycles. And of our DAO community, about 22% of our listeners needed to use IVF treatment due to male factor infertility, which is just really, really interesting.
It's very important to highlight. Yeah, because
really, really important.
As we know, it's 50% sperm and it's 50% egg. So
and it takes 2 to tango.
It does. It really does. So if there's any male factor, things to address there, like Liz mentioned, let's do the hard work now.
Yeah.
You know, sperm does regenerate. You know,
that's the most
things can
incredible
be
thing about sperm.
improved so efficiently, within that 3-month window. So, like we kept talking about, gathering information as we go through different stimulatory cycles. If something's not working, maybe take that step back, work on the body, nourish the soil, and you may find that, the future cycles you'll be able to get better outcomes, because we see the link there clinically and we can see it in the research, early pregnancy loss, depending on the types. Obviously, there's lots of different avenues. But, we can often link it back to the sperm quality.
Absolutely.
Yeah.
Absolutely.
Okay. I have another question for you girls too today. So I've been told I have a low AMH for my age. Does that mean I should start IVF or freeze my eggs?
Great question.
It's a challenging one, and I feel like this is so heavily dependent on everybody's circumstance, what your age is, where you're at in life. Are you ready to start a family? Are you prepared to welcome a baby into your life? All of this comes into it, and there's a lot of fear-mongering going on with AMH at the moment.
The anxiety-making hormone, otherwise known as the anti-Malarian hormone.
Malarian, yes.
Malarian. I want to pull back and talk about when they got their AMH checked.
Yeah, good point.
Yeah, so let's pull back before they're even thinking about freezing their eggs or IVF. Have they just come off the pill? How is their lifestyle? Whereabouts in their cycle was their AMH checked? Why in the first place did they get AMH checked? I think probably over the last 5 years it's been a bit buzzy.
Yeah.
I don't know why it's come back.
Yeah.
But I think social media influence has been a big part of that.
Yeah.
But to be honest, I don't actually check AMH other than if a patient is planning on going through IVF, because we want to make sure that there is an egg reserve there. But we know that AMH levels can fluctuate.
Oh,
Definitely.
Significantly.
And especially it's dependent on lifestyle as well. I've seen with patients who come off the pill, yes, it can be low, but it can also be very elevated as well. So I think
it is another marker that they'll use to examine PCOS as well, whether they're measuring the antral follicle secretion of AMH to see if that's above the average, which can indicate more follicles sort of on that ovary.
which is also often misdiagnosed after coming off the pill.
Definitely.
So we have a whole generation of women who've been on the pill for almost a decade, if not more, who are now checking their AMH levels. So I think that would be number one.
Yeah.
Number two, I think the factors of what you've said. Are they ready for a family? Cost-wise, and the reality of freezing your eggs. I can't recall the stats.
I can. I've got some stats here.
Amazing, because freezing your eggs they need 40 eggs.
I think when you're freezing your eggs, because eggs are single cell, they need to get many of those eggs so that they survive the process of freezing and then defrosting. Whereas if you're collecting a bank of embryos to freeze, they can do it with lesser numbers. So roughly 2 to 3 cycles of egg collections are recommended for women who want to freeze their eggs, to have a cohort of roughly 30 to 40 there.
That's insane.
Which is huge on the body.
I think it was 40 eggs only creates like 3 to 5 embryos. So
And then of those 3 to 5 embryos,
can they survive the
Yes.
defrosting process? And also just, we know the outcomes with transfers. It doesn't always take on the
1
first
in
go.
3
And the cost associated
percentage-wise.
with it.
cost, and then for their health as well.
Yeah. I think it costs anywhere from $7,000 to $10,000 per IVF cycle. And then the cost rate of having those eggs in the freezer is roughly $500
You need to rent the freezer space every year, which they don't tell you
per
about.
year. So if you're thinking about freezing your eggs in 20, just say you're on the corporate ladder, you don't want to have children yet, you're thinking, I'm going to do some fertility preservation, you're paying a lot of money out of pocket. And also, interestingly, an analysis of the eggs stored at Monash IVF clinics in Victoria between 2012 and 2021 showed that fewer than 13% of patients returned to use their eggs each year. The main reason being that they naturally conceived.
there we go.
Yeah, absolutely.
Yeah.
So is freezing your eggs a solution to low AMH?
I think, again, it really does depend. But if you're in your, I guess, later 30s, early 40s, mid 40s, freezing your eggs isn't usually the option I guess specialists would recommend, just because the quality of eggs can sometimes be more challenging, can decline from that age onwards, and it would be more important for you to consider actually freezing embryos if that's something that you wanted to do, if you had a partner that you were with long term, or if you're doing this by yourself and you use donor sperm.
Absolutely.
So it is very, very much based on individual case.
Definitely.
And also, when I think about someone in their early 20s, I wonder if they put that money aside to supporting their health and fertility through lifestyle and acupuncture.
Yeah.
That also would set them up from a fertility perspective.
Yeah.
I also think, we haven't noted it, but if there has been someone who has had amenorrhea for a long period of time, amenorrhea is a lack of period or absence of period, so not ovulating. That is a time where I would be considering AMH if, from a fertility perspective, that was something that they were considering as family planning over the next few years. But again, you'd be working on getting their period back and helping them to ovulate first.
And likely when they do start ovulating frequently, the AMH will probably go up from that point.
Yes.
Yeah, interesting question, actually.
Yeah.
Yeah.
Okay. So as we wrap up, I thought we could mention some of our recommendations that we have for our listeners who might be on their IVF journey or interested in ART.
I'll start. I think number one is building your multidisciplinary team, and that begins with a wonderful GP that you feel heard with, that are open to doing blood tests for you, and then finding a brilliant fertility specialist who is a detective, who is listening to you, who sees you as a person, who answers your questions and digs a little bit deeper. If you're not getting optimal outcomes, whether that be from egg pickup or whether that be with unsuccessful IVF transfers or early pregnancy loss, are they looking for more answers?
Yeah, the whole picture.
The whole picture. And again, seeing you as a person, I think it's important. Finding a fertility specialist is a little bit like dating. If you go to see a fertility specialist and just something's not sitting right, like what Molly was saying, you don't have to commit to them.
No.
Because the thing is once you commit to a fertility specialist and they have embryos of yours in the freezer, depending on the clinic's policy, things can get a little bit tricky if you want to change clinics. So have a chat to a few fertility specialists is my recommendation, and find someone who you feel like you're a part of a team with, rather than that medical hierarchy where there's the doctor and here's the patient. See that you're seeing eye to eye so that you're finding the best outcomes for you and your partner and your family.
Definitely. Yeah. Any recommendations, Molly?
Something that I always highlight to my patients when they are in the midst of an IVF cycle is utilising the IVF counsellors.
Yes.
So, whether you're with IVF Australia, for example, or City Fertility, there's lots of different clinics that you can go through. They've all got IVF counsellors, and these people know the ins and outs. They can answer any question that you think is silly. They will have an answer. And I think it's often something that our patients forget. Is a tool there. And I always encourage my patients to call them or book an appointment in so they can unpack any of the feelings, any of the emotions that they may be having, and to get some answers about the questions, because there's no silly questions. And often when we're, doing our first stimulation cycle, the nurses are amazing people, and so the IVF specialists, but it's very much like, okay, let's go. These are your drugs, XYZ, let's go, bang, bang, bang. And sometimes it's like, oh, actually, what is happening? How am I feeling?
Yeah.
And so these amazing counsellors can provide some really great insights and understanding if you have any questions at all.
100%. Because I think when you're on the fertility train, sometimes you don't have the space to hold space for yourself of how you are actually feeling, because you're so focused on that treatment protocol. And that, 4 weeks is an absolute whirlwind. So it's like, even if you don't need it, just book that appointment.
And your partner too, if they're unsure of the ins and outs or how they're feeling too, I think, reach out to the services, because that's why they're there, and they get it. They understand what the process is, and they understand how you're feeling as well.
Definitely. Totally. Just some quick recs from me. I love Lucy Lines on Instagram from Two Lines Fertility. She's an embryologist, and she talks funny things and reality checks on all things IVF on Instagram. So go ahead and follow her. And then also a really great book is Eggs Unscrambled by Agnes Fisher, which unpacks egg quality and everything related to that. So it's is it on Audible? I don't know if it's on Audible.
We have the hard copy in clinic, but I would imagine it's on Audible.
Yeah. Anyway, check it out, listeners. See if you can get your hands on it. But yeah, great recs, girls. So that's a wrap on our third episode. We hope you enjoyed today's episode from Delve by the Dao Health. And please follow us on Instagram. Send us in all your burning questions to the links in our show notes, and we will be seeing you on our next episode.
Bye.
Bye.
Thank you for listening to this week's episode of Delve and being a part of our community. Follow @TheDao on Instagram to vote in our polls and stay connected. Ask our team a Dear Dao Does question via the link in our show notes. And for more information and to sign up to our newsletter, visit our website.
The content provided on this podcast is for informational and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional with any questions you may have regarding a medical condition.
Leaving a review on Delve helps others to find our show and increases awareness for women's health and traditional Chinese medicine. We would love if you can take a moment to like, subscribe, and share. This episode was recorded on Gadigal land. Always was, always will be traditional Aboriginal land.